Welcome to the City Current Show. I'm your host, Andrew Bartolotta. We're always honored to bring you inspiring stories of individuals and organizations making an impact, empowering the good in our community and around the globe. Today, we're chatting with Kim Van Frank, the Executive Director of the Mid-South Transplant Foundation, to shed light on the critical importance of organ and tissue donation. With over 100,000 Americans waiting for a life-saving transplant, the need for donors is more urgent than ever. In fact, every 9 minutes, another person is added to the waiting list, and tragically, 17 people die each day because the organs they need are not donated in time. Kim is here to discuss how the Mid-South Transplant Foundation is making a difference in our community and how just one donor can save up to 8 lives and enhance the lives of more than 75 others. So let's delve into this life-changing conversation to learn how you can get involved with the Mid-South Transplant Foundation. Kim, thanks for joining us.
Thank you so much for having us on, and you did a great job introducing, the great need in our community. So thank you very much for having us and letting us share the need as well as the positive stories.
Of course, and we're going to talk a little bit more about that. But yes, you have some really fantastic statistics on the importance of organ and tissue donation. Give us an overview of the Mid-South Transplant Foundation and its role to play in organ and tissue donation.
So Mid-South Transplant Foundation, we are the federally designated organ procurement organization. So we call ourselves an OPO for short. There's only 56 of us in this country. And so our organization, we serve Western Tennessee, Northern Mississippi, and Eastern Arkansas. And in that, we service about 54 hospitals.
Wow. You had a record-breaking year for saving lives last year. Share some of the highlights and the factors that really contributed to the success.
We did. We've been working very hard over the last couple of years, coming out of COVID. Some of the hospitals were locked down. The venues and businesses where we go and do a lot of public education, they were locked down, but everything is opening back up. I'm so grateful for that. And so over the last 2 years, we've actually seen some record-breaking numbers. We've had like a 71% increase in the number of organ donors. We've had like a 25% increase in the number of tissue donors. And I'll talk a little bit more about the great impact that is having. But part of the reason is we've been out. We love doing shows just like yours because we want to educate the public on the importance. And that's part of the reason we've seen the increase is we've been out there educating more. We've got some announcements on television, radio, shows like yours. A lot of businesses in our community have been supporting us. Honestly, people have good hearts and they want to help others. And that's what we get to witness every day when somebody says, yes, I'm losing a loved one, but they take a moment and pause. And they can say, while I'm losing, I want to give. Is that not a great story to be told? We hear so much negative things on the news, but what we do every day is so positive. So we have the generosity of our community wanting to give back and help others. And it's making a difference in many lives.
It really is. And to me, it's a no-brainer. I mean, if you are you're at end of life and you're deciding to be an organ donor, a tissue donor. I mean, you are giving back in so many different ways to dozens of lives, potentially being able to donate what honestly is going to go to waste if you're not going to donate. So to me, it's a no-brainer. But you've got over 100,000 Americans waiting for life-saving transplants. You've got over 4,000 specifically in Arkansas, Mississippi, and Tennessee.
Yep.
So talk a little bit how Mid-South Transplant Foundation works to address this need specifically for those 4,000 individuals needed in our tri-state area.
Well, one of the things is that we work very closely with the hospitals that we serve. I told you we work at 53 hospitals, and the process really does start with them. They have to let us know when, the hospital staff, and that's one of the myths that I want to dispel up front. The hospital staff, the doctors, the physicians, their goal is to save every life. Every patient that walks in their facility, they want to do everything that they can to save that life. But we all know that death and that everybody that due to illness or injuries are not going to survive. And so when that time comes, that's when we count on the hospitals and they call Mid-South Transplant Foundation. And then we have one of our team members, which we're experts in this. And then only then do we come in when it's determined that a person's not going to survive their injury or illness. We get called, we come in and we assess the patient to determine if they even have the potential to be a donor. And once we determine that, then we have individuals that we then start working with that family and provide. First of all, we want to provide care for them. You know, they're in a difficult place in their life. They're losing a loved one, and usually it's very sudden. So we come in and we care for those families. And then we just let them know, you know, what their options are. And so we explain how their loved one can really change the end of their story, you know, that while we think their life here is gone, they can still live on and help so many other individuals and keep families together and friendships together. And we even have recipients that go on to have babies and create new families. And so we share that with them. And but it takes the families a while, you know, they're adjusting to a lot at that time and a lot of decisions to make. And so anyway, those families graciously say yes. And then we then work with a whole different group of individuals to find recipients for those gifts. We call those organs and tissues gifts. And we find recipients and work with other hospital and transplant programs around the country. And then after those gifts are given and received, and we still follow up with our families. We have what we call an aftercare program that we love to stay in touch with our donor families. And they tell us that donation really does help them. And our motto is give hope, you know, give life. And we do give hope to these donor families that better days are coming. And they're so renewed when they can find out how many lives their loved ones touched. So, you know, that's the biggest way is we make a connection and we care for those donor families and help them in journey with them. And then, you know, after that, after time has passed, many of these donor families want to come back and volunteer with us. And that's one way we help advocate for these 4,000 individuals waiting, because we know the gifts that the recipients receive. They've received new life, they've received healing, but also the donor families also receive that, you know, that healing from that. So that's sort of how the process works. And one of the ways, primarily ways that we help advocate for those 4,000 individuals. And I'm very grateful for our hospital partners. We join them to care for their patients together.
It really is a collaborative effort, and I imagine such a highly skilled situation where you're able to go in and have these relationships with the hospitals and the families to be able to curate these organs and tissue donations to then gift them to those in need. It's such a selfless decision for those that decide to be a organ and tissue donor. What are some of the most common reasons for someone needing an organ transplant? And then just what's a fun fact on which organ is most in demand?
Well, so, you know, it's when we talk about organ transplants, we're talking about heart, lung, pancreas, liver, kidneys, and intestine. So a variety of things can cause an individual to need an organ. People don't know it, but individuals can just have a virus that can attack their heart. So you can be healthy today and have heart problems and heart disease tomorrow. Hereditary, you know, if you've got a family history of cardiac disease, that can cause you to have heart issues. Children born with cystic fibrosis are going to need a lung transplant. But, you know, the most common needed organ in our community is kidney. And, you know, if we look around, many dialysis centers, and partly because our population has a very high prevalence of hypertension, diabetes, and both of those over time, if you don't care for yourself, and even when you do care for yourself, sometimes you're going to get, your kidneys are not going to work well and they're going to start to fail. And, you know, and most of us we look around over our lifetime, we will potentially know somebody that's going to, we think it's a rare thing. And it's like, oh, there's 4,000 people. There's a lot more people in this city, but it's amazing how many people you will know or have connections with that will need a life-saving organ transplant. And someone with kidney failure that are on dialysis, it really is life-changing. There's two ways, they can treat that. Some with medication, but if on the more where they have greater kidney failure, there can be on like peritoneal dialysis, which means every night they have to have this fluid and you put it in your abdomen and it stays overnight. Then you have to drain it. So you can imagine, if you're not medical, the stress of learning that and needing a good support system, to do that. And what we're more familiar with is dialysis, where you have to have to go to an actual place and get connected through IVs and various machines. And you literally stay there for like 4 to 5 hours, 3 times a week. And, a lot of times patients feel really drained because they're tired, the kidneys are failing, so they're not able to work. And sometimes they don't feel like driving themselves. So then you need, your social support to help drive you there. So it's really draining on not only the individual that needs that kidney, but as well as that those families that have to care for them. And, one of the things I think of that we tell everybody, how you can help somebody in this situation. But think about, we've got the hot, muggy days of summer coming up, and you've got kidney disease, and you go outside for a little bit and you're so thirsty. And somebody tells you, well, just because you're thirsty, you still can't drink but so many ounces of water a day or so many ounces of fluid. So, drink a glass of water, we'll have an ice cream cone, anything that turns into liquid. Somebody with kidney failure, you have to constantly watch that. Even salad dressing on your salad, people don't think about the limitations, but they really can't drink and have typically more than 32 ounces of liquid a day. And most of us, we've been told to drink at least 64, and that's just of water, much less coffee and, anything else that we may drink, but they're limited. And it's really life-changing, because when they get a kidney transplant, they're literally cured. I mean, literally they wake up and they no longer have kidney disease, and they can drink as much as they want. And it's just a true miracle. And probably about 85% of those waiting for an organ in our area are waiting on a kidney.
Wow.
Yeah.
That is some amazing statistics. And I'm a type 2 diabetic. And so I'm learning about that.
Wow. Take care of yourself.
Yes. Amen. It's a huge risk, and something that we constantly think about. I also know what it's like for a family member and friend to not receive an organ donation because they were waiting on the list too long. My uncle needed a liver transplant, and so unfortunately he didn't make it because he was too low on the list. And then I have a friend in Mississippi who received a liver donation a few years ago, and it saved her life. And so it's really cool just to see how important and how beneficial it can be to be an organ donor, a tissue donor. So what is it like to sign up or register as a donor? What are some of the misconceptions about signing up as a donor, and what is that process like?
First of all, it's so easy to sign up to be a donor. We say you register yourself to be a donor. We don't want those organs today. We want those organs when you don't need them anymore, like you said. And so that's kind of a myth. We don't want them today, later on when you don't need them. And the easiest way, honestly, is to go to our website, midsouth-transplant.org, because we cover 3 states and you register by each state. So if you go to midsouth-transplant.org, you can hit a register now button, and it'll take you to the appropriate state that you live in. So it's very easy. They ask for a couple of key pieces of information, typically your driver's license number, and it's that simple. And so one of the myths of why people don't sign up is they're afraid that if they sign up to be a donor, that if they ever do get sick or injured and they go to the hospital staff will not try to save them. And that's probably the number one reason. And we talked about that earlier. That's absolutely not true. When they get to the hospital, Mid-South Transplant, we're not even there, and the healthcare team is doing all that they can. And like I said, only when it's determined that they're not going to survive their injury or illness will we get called in. So that's the number one myth. And I think the second piece is that people just don't like to talk about end of life issues and death. And I appreciate that because it's sort of sad when we think about losing a loved one and them not being here. But reality shows that we are all going to leave here and we're all going to pass away. And so, we make many plans, don't we? For our end of life as we get older, or even young folks. It's never too early to start making plans. We make plans for retirement. Maybe we have a home, we have a precious family heirloom, and we want to make sure that goes to someone special. So we create a will, don't we? And we say what we would like to do with our stuff. Many of us create a living will. So when we get sick, we want to help our families know what we want. Like, I don't want to be left on a ventilator. I don't want a feeding tube. These are all realistic things that many of us, or if I get sick and I can't make decisions for myself, I want to give my husband or my son or someone the ability to make those decisions. Those are all things we plan for. And so when you register yourself and you put in your will or your living will that I want to be a donor, it's simply just a decision you get to make for yourself. And it's an important decision. And I always encourage everybody to make that important decision for themselves. We all have enough decisions to make for ourselves, don't we? I don't need to be making decisions for everybody else in my family. So I tell them, you let me know what you want, and I'll be sure and honor that decision. And that's simply when you register to be a donor, you're just saying, this is what I want. We do encourage you to tell your family. Because that way it helps prepare them when something happens. I will tell you some individuals say, well, I want to be a donor. I want to register, and I have, but maybe I have a family member that's not quite there yet and doesn't want to do that. So I don't want to upset my mother, or I don't want to upset my whoever, so I'm not going to tell them. And I'll say, well, that's your choice, but surprise, it's not good,
Yes.
So I understand it and will help honor your decision. But if you can work it into your family conversation, that would be great. But if you can't, I understand that as well. So, but it's very easy, midsouth.transplant.org, easy to register.
I love that something that makes such a life-saving impact is so easy to do. And
Easy.
making a decision for yourself to, your heirlooms inside your organs and tissues, to be able to donate that is, like I said earlier, selfless and a way to give back when you may not even be here on Earth. And so to be able to do that is such a great thing. Talk about what the Walk of Honor is and how it commemorates the life-saving impact of organ and tissue donors.
I honestly think that is one of the most precious things that we get to be a part of. And so that's something, again, at Mid-South Transplant Foundation, we help organize. And again, we do this in collaboration with our great hospital partners. And so what it is if we have a family, that's in the hospital and we approach and their loved one has registered themselves to be a donor. So we know they're a donor, or they choose not to make that decision and they give the family the option to make that decision for them. And the family decides for them to be a donor. We offer them a walk of honor. And what it is that at a key point in time, we ask the family, is there anything that you would like to say or do? Because when we get ready to take their loved one from typically their hospital room, which is usually in an intensive care, and we literally take them on their hospital bed down to the operating room where we will then recover those gifts. We call it a walk of honor. And hospital staffs, they can have family members, friends. We all line the hospital walkway, the halls of the hospital, and usually stand in complete silence just to recognize that donor hero that's going to be wheeled down the hall. And it just gives an opportunity for us to have a wow moment to say, oh, this individual has passed. What great things and how many people will he or she help. And it just solidifies the whole process, and it's beautiful. And Sometimes recently, we had a family that had a pastor that they wanted to be a part of that. And so he sang as we wheeled their loved one down the hall to the operating room. And then when we got there, he said a prayer. The family said their final goodbye. And, not a dry eye, but so moving because we all appreciate what this person is doing. So it is just, you can tell it is just a phenomenal experience. And I remember when we did that, and one mother looked at us and said, "Thank you." So here she is losing her daughter, and she turned around and said, "Thank you," because we know that donation helps in that healing process. And they're proud. A parent especially is so proud to know that their child is not going to be forgotten and is going to live on. And so I'll never forget when she turned around and said, "Thank you." So just some precious moments with our families in our hospitals. Yes.
I mean, Kim, you're not supposed to make us cry on this show.
It's just a
Oh,
moment.
wow.
I'm telling you,
There's not a dry eye
it's a
between
beautiful moment.
tearing up. I mean, man,
I just, I hope that just relays, the value and just the awe that we feel for our donors and their families. And it's simple to do, yet it is so impactful. And so thank you for asking that question, because it's just something one way we can give back to say thank you to our families too. So, yeah.
That is so powerful and heartwarming, and just a great way to, and it also makes it make even more sense on why you call them gifts, and how you're able to help so many people. And for the pastor to sing, or for the mother to turn to you and say thank you, it just goes to show that you all are you're not taking this lightly. You're not taking leftover organs this is a gift for someone, and you are transferring life from one person to another. You're transferring hope. You're transplanting hope. Really,
we really are. Hope to everybody, even hope to that hospital staff. They're losing a patient too, and they feel a loss. And so it's a nice healing moment for everybody.
Beautifully said. Where can people go to learn more about Mid-South Transplant Foundation and support your efforts?
Well, we would love to go to midsouhtransplant.org. There is all kind of there's information about donation. We typically have how do you get involved to be an ambassador for us? If you're a recipient, if you're a recipient family, if you're a donor family, if you just believe in donation, there's plenty of opportunity for you to volunteer with us. And it can be from speaking and telling a story if you like to speak. It can be teaching at the driving schools. We love to get retired teachers in there. Kids are so open to it. We do defensive driving schools, so we get some adults in there. We have health fairs. We have a variety of things. We even have some opportunity to even work in the office. If you're retired and just want to be around individuals, we have some administrative things that we bring volunteers in just to be around a group of individuals and to be a part of our mission. So go to our website. You can sign up to be a volunteer. It tells you how to reach us with our phone number. We have some big events throughout the year. We just finished Blue and Green Day, which was held on April the 14th. And we had this every year in April. April is Donate Life Month. So that's really we're constantly out in the community, but we really kick it up about 10 notches in April. So we lit the bridges up a couple of weeks ago. We had over 100 businesses that lit up their building and space in blue and green. Wore blue and green. Everybody in their workspace wore blue and green. Saw some really unique clothes. I didn't know there was so many green clothes, around. And they dye their hair green. It's just, anything to help bring awareness. So visit our website. So we've got some facts, some opportunities, some special events listed there.
Well, Kim, thank you so much for coming on the show, for transplanting hope and healing for so many. Thank you for all you're doing at Mid-South Transplant Foundation.
Thank you again. And thank you for sharing your personal connections with donation, because you're the individuals that it matters. You've been affected both ways. And so it's real, isn't it? And I mean, that's sure it's not something we talk about. It's real. So thank you so much.
Thank you.